The Ministry of Health has equipped over 2,000 faith-based hospitals across the country registered under the National Hospital and Insurance Fund (NHIF) with sufficient manpower and medical resources to administer emergency, primary and secondary health care to Kenyans.
And we want to urge members of the public, those who need inpatient services or operations to deliver, because majority deliver at the health centers which are operational, to go to the nearest faith-based organization or institution. They will be offered services by the institutions, and the institutions will be able to claim that from the National Hospital Insurance Fund.
To support such facilities, the ministry will rechannel medical supplies to non-operational level 4 and 5 hospitals to the facilities as a way of circumventing the doctor strike.
If drugs are not moving in level 4 and level 5 institution, it is important to distribute those drugs to the faith-based organization to relieve them from spending, because in the last few weeks they have been waiving the fees to Kenyans.
Health Cabinet Secretary Cleopa Mailu says that his office will be holding talks with various county governments to second nurses to such facilities, and it may plan to hire over 10,000 residential medics to help or replace defiant medics who will face the sack.
We are also urging the counties, and we are working with them, and on Monday we are having a meeting with the Committee for Health for CCs to be able to tell them, if in an institution like a hospital there are few doctors and there are many nurses, please second those nurses to the faith-based institutions to be able to assist them to help Kenyans. In this country, we have over 10,000 doctors resident in this country. We shall explore every possibility, including locums, including sessional doctors who can offer services in the various institutions of their choice to ensure we restore services.
Mailu further directed Kenyans to seek medical attention in over 6,000 public health facilities in the country that are still operational and are administering primary health care.
Sitting at home is not acceptable, because dispensaries are functioning, health centers are functioning, and even those hospitals, there are clinical officers who can support them and refer them appropriately. So I urge them to be able to go to those facilities.
Despite holding an evening meeting with the union officials on Thursday after the court's ruling, the defiant doctors refused to budge even with the threat to sack them.
We have given them audience, but they still insist on the CBA. We leave the process of the court to take place. They are in contempt of court. That is not within our purview.
The government, in the meantime, has dismissed rumors that it is hiring foreign doctors, but said it's part of the option on the table.
The head of state did not go to India to look for doctors. It's only me who can begin the process. And I want to assure you, we have not gone into those inroads with the government of India. I have told you, it's a thought we are going to entertain as we solve our problem. At the moment, we want to believe that our doctors will come back to work.
Mailu's stand is that the signed 2013 CBA must be implemented within the salaries and remuneration guidelines.
They are public servants, they are civil servants, and they are governed by the Public Service Commission, the rules and regulations, and the SRC advice.
Mailu maintains that the doctors must convince the Council of Governors to sign a recognition agreement with them for the CBA to hold water.
Let nobody cheat themselves. We have a devolved health system. That devolved health system will be, as long as the Constitution says so.
Juni Karisa for Channel 1 News Hour.